So, we're talking about the treatment of obesity, and we're going to start with the dieting cycle. This is very, very common, and I got trapped into this when I was having those thyroid issues, and gaining weight, especially as a dietitian and nutrition professor. There was a lot of shame associated with that. So, I was pretty desperate to lose weight. So I started going on diet after diet after diet, and it just made the problem worse. So here's what happens. I know it's small and hard to read. You can look this, you can get the slide set off Blackboard so you can see it better. But this is very, very common. So, first you decide, I'm going to go on a diet to lose weight. Before you go on your diet, and it always starts on a Monday, it seems, you go on the pre-diet binge. So you're going to eat all the foods that you're not going to eat on this really restrictive diet, okay? So then, you go on the diet, okay? And a lot of times, sometimes, not always, it involves really intense exercise regimen that does not feel good when you're overweight. Your main thoughts are about the diet and weight. You think about the foods that are forbidden more often. And that's a natural phenomenon. They've done studies on prisoner of war camps and concentration camps that the people who were deprived of food started having food fantasies. That's something that is normal with a really restrictive diet or low calories. You're sore from your hardcore exercise regimen, and that doesn't feel good, but you do lose some weight, yay. But you're hungry and hangry a lot of the time, especially if you use food as a coping mechanism. You get really irritable. You start thinking about food and weight even more, and you start white-knuckling it through the days, like really resisting temptations because you're thinking about food all the time, but you're denying the body's normal physiological response to want to eat even more now that you're losing weight. So it's a tremendous amount of mental effort to fight off the body's natural desire not to starve. Okay, you start to run into situations that make it difficult to stick to your diet and exercise plan, like a party or the holidays. You go on vacation. You may have an injury, or you don't. You're sore from exercise, and so something makes it even harder to stick to the diet. Or there's some stressor that makes you lose that cognitive restraint. Your natural desire to want to eat. So you blow it and you go on the post-diet binge. Because when you blow it big. And again, it's the body's natural response to starvation, to binge. Okay. So you go on your binge, but your hormone profile is shifted, to prevent starvation. You've stopped your exercise program because it wasn't sustainable. And the restrictive diet has slowed your metabolism, so you gain the weight back and maybe more, okay? So you're bummed, your self-worth is diminished, you're depressed about your lack of willpower because you think, sticking to a diet's about willpower. You start looking for another weight loss program. You find the program that you think will work this time. Then you go on the pre-diet binge, usually Sunday, because you start your new diet on the Monday. So you get into that cycle, and it can go on for years or decades, and you end up way bigger. Oprah has said that, she started her first diet and then gained 80 pounds. Okay, so for me, my weight issue was part thyroid disease, but a lot of it was going on this pathological cycle of dieting. I had developed this diet mindset, and I couldn't get off this merry-go-round because I was afraid if I stopped trying to diet that I would gain even more weight. So for me, actually, the key was getting off that cycle of dieting and my thyroid regulated. So this is a really interesting study. It's a classic study that was done, published in 1950, and I do not know why a healthcare professional would recommend a very restrictive diet, a very low-calorie diet for anyone who is trying to lose weight and keep it off. It's called the Minnesota study. So there were people who were conscientious objectors to World War II, and to get out of the military, they could volunteer to be in this study. There were 36 men of, I think, about 100 who applied, who were psychologically and physically fit enough to qualify for this study. So it was 6-month caloric restriction, about half their usual intake, and because people were much more active back then, and these were young men, their usual intake was about 3,000 calories a day, so the restriction was about 1,500 calories a day. So it wasn't an extremely low calorie diet. So over the 6 months, the men lost 25% of their body weight. And the original intent of the study was to look at the physiological effects of calorie restriction and weight loss. But they found some things that they weren't originally looking for. They found dramatic increases in food preoccupations, including, in fact, I think two of the men changed their career paths and became chefs. When food was available, now they lived in a controlled environment. They lived in a dormitory type setting. But when food was available, they would hoard it, they would hide it, and then they would binge when no one was looking. 20% experienced extreme emotional disturbances. Now think about the percentage of people who are on a restrictive diet at any one time in the U.S., no wonder, maybe that explains road rage. They were angry. There's more anger, depression, anxiety during the restriction. And the binge behavior persisted in some after the experiment. So it messed up some of their appetite regulation mechanisms. So that's evidence that extreme diets can backfire. Now, I'm going to talk a little bit, I think I've talked about why it's so hard to lose weight when to keep weight off once you've lost it, maybe not. But the good news is a weight loss of only 5 to 10% of excess weight can result in significant metabolic improvements. So someone who weighs 300 pounds can see an improvement in blood lipids like cholesterol, triglycerides, blood pressure, blood glucose, inflammatory markers with a loss of just 15 to 30 pounds. That doesn't take them down to their, the BMI of, 18.5 to 24.9, but they will see improvements. So there is kind of a different perspective. Back in the day, we used to put people on rigid diets to lose weight, and we found that people weren't losing weight and keeping it off. And it's still, the success of weight loss programs is still, relatively low. So permanent weight loss requires a different way of living for the long haul. A diet is not temporary. There's usually a mind shift, a mental shift that occurs before a person loses weight and keeps it off long term. They realize, oh, this is forever and I have to commit to this. I may have to give up some things that I really like, and I may have to adopt some behaviors that are not quite as fun. You have to treat underlying physical problems, like the thyroid, if someone has thyroid disease, if they have injuries, because we'll talk about the amount of exercise that's needed for weight loss and maintenance of weight loss. You need to assess readiness for change. If a person tries to start a new lifestyle program and they're not in a good place to start it, it'll probably be met with failure. And that just reinforces, their lack of self-worth. So you try to get them all set up, or get yourself all set up to be ready for a lifestyle change. It can mean simplifying your life. It could mean, changing jobs or careers. So anyway, you have to get yourself set up to be successful. Gradual dietary changes are easier to comply with, so a lot of people that we work with, we have them set small behavioral goals. Whenever you ask someone what their goal is, they always say a goal weight, and we're like, no, let's set a behavioral goal, because if your behaviors are on point, then the weight should fall to, start falling to something that's manageable and healthy for you, realistic and healthy. A lot of times we do a diet history and we try to figure out one thing that, contributes, that if it was modified, it would make a big difference. And a lot of times that is high calorie or sugary beverages. The people that I work with who have a sugary beverage habit, whether it be, mochas or lattes or sodas, they generally lose about 20 pounds, pretty quickly when they stop drinking the sugary beverages. Deprivation can lead to binging, so, we aren't as, for most people, we don't deprive people. I'll talk about one of the diets that was going around, OptiFast. There are these fasting diets that were going around a long time ago in the late 80s. Oprah was on one of them, where you just drank 5 shakes a day, and it was about 475 calories. People lost dramatic amounts of weight because they didn't need to make any decisions about food all day. I mean, their environment, it was like no food. So, this is it. So people lost tremendous amounts of weight, but like Oprah, almost everybody gained it back because the deprivation was severe. Trying to find what works for the individual, addressing emotional eating issues, focusing on behaviors rather than numbers. Okay, I'm going to stop this one here and we'll continue with the next group of slides.